Welcome to Vanderbilt. We really regret that you could not visit us in person. By now, you probably did have your virtual interview and had a chance to meet most of us, as well as get to know some nuts and bolts of the program. But I'd also like to take this opportunity to introduce Sarah Taylor, who's our nurse practitioner, and Laura Vandelar, our current fellow. So the campus here at Vanderbilt is, as you can see, embedded in a very tree-dense part of Nashville. In fact, the campus, which includes a wonderful mixture of classic and new architecture, is also a registered arboretum. The campus is essentially occupying this triangular space you see here in Nashville, but I want to highlight the spot here, which is enlarged, showing the medical center. It's essentially organized as three parallel rows of buildings, starting with the medical school, the hospital, and some outpatient pavilions. The one where you'll spend most of your time is Medical Center East. So that's what this looks like from an aerial view. We're going to start the tour inside the hospital, which looks a lot like any other hospital that you're familiar with long corridors and elevators and operating rooms and plenty of equipment. But I want to show you some of the unique aspects that you might not get thinking about the fact that the hospital pretty much probably looks inside like the one you trained. Outside, though, this is a view from the courtyard between Light Hall, one of the medical school buildings, and the hospital. Essentially, the area shaded here in blue. During the day, especially during the spring and fall, you'll see a lot of people just walking through here during lunch or sitting there and having lunch. Even people have meetings out there because it's really just a very pleasant place to be. The hospital is connected by these bridges, which I've put in blue here, to that Medical Center East building. So here in the photograph, we're standing on one of those bridges, looking left at the hospital, and right where all these windows are is Medical Center East. So let's take that bridge and walk over into that tower. And now we're in Medical Center East at one of the surgeon's lounges. The vantage point you see here is the blue arrow, and we're looking across Medical Center Drive, which is this road separating the hospital from the Medical Center East and other pavilions. So looking across Medical Center Drive, we see Medical Center North. Medical Center North is one of those classic buildings that has been retained and reasonably well kept. In fact, the interior of it is quite unique. There's a mixture of inpatient care space still there, which is a testament to this building once serving as the Vanderbilt University Hospital. Now all that's left of it for patient care is just this area you see here. The rest of it consists of research labs, including Dr. Turner's basic and translational lab, as well as an engineering surgical science lab where Dr. Russell is instrumental in development of robotics and other unique aspects of developing surgical technology. Every year, the division has a Rhinology and skull-based cadaver skills dissection course that's also held within Medical Center North. So back in Medical Center East, taking the elevators up to the 7th floor brings you to our waiting room. Right now, as you can see, it's configured for social distancing. Those windows are the ones that you saw from the bridge. Taking a closer look out those windows, you can see downtown Nashville in the distance, but you might be wondering what this playground is here in the foreground. Turns out that the Department of Otolaryngology at Vanderbilt is part of an entity called the Bill Wilkerson Center for Communication Sciences. So in addition to us, we have the departments of audiology and speech pathology that are incorporated into our unit. The department, well, as part of the Bill Wilkerson Center, we have a school for deaf children, and that school just happens to be on the 6th floor, just beneath our clinic. So in the middle of the day, people in the waiting room or in some of the offices might hear giggling children outside. It's quite unique and refreshing in some ways. In the waiting room over to the far wall, you'll see our history chronicle. The department is really only 30 years old, just a little bit more than that. That's how long we've had a training program. And during that relatively short time, there's a lot of very notable milestones that have been accomplished, and these are all chronicled here, as are the names of the endowed chairs, as well as service chiefs and chairmen. We really only had 2 chairmen with Dr. Ossoff serving for a long time until Dr. Eby came along in 2009. So Dr. Ossoff was the chair from 1986 to 2009, and now Dr. Eby recently just celebrated his 10-year anniversary as chair last year. Taking another look around the clinic spaces, you'll see a lot of evidence about how the department grew up with the music industry. The two um, really fed off of each other, and it was a competitive advantage for a Department of Otolaryngology to be in Music City. A lot of grateful patients who uh, donated their signed and autographed photographs, as well as gold, silver, platinum albums adorn the walls there to the extent that it really looks like a museum. Going up to the 8th floor, this long corridor leads to a room where we normally have our grand rounds. The grand rounds, things like that, are all done virtual these days, but normally you would walk down this hallway at least once or twice a week. And what you would see here is all of the history of how we were and have been the center of communication sciences for Vanderbilt University, and the contributions in that regard that we have made to the city of Nashville. So in closing, I really hope that you learned some more about us from this tour. I wish and I hope that you have a chance to come visit us in person some days. There you see my email. If you have any questions about the program, please do not hesitate to contact me directly. Be safe and be well.